pleasure, without further ado, to introduce your speaker. Is Dr. Abigail Levrini, licensed clinical psychologist and owner of the practice Psych Ed Coaches. And what we'll do is we'll put it up on the board, or is it on your material, the actual website?
It is on the last page of the slide.
So you have a way to reference. Psych Ed Coaches is a group of licensed mental health practitioners specializing in executive functioning and ADHD coaching, with offices in Sterling, Alexandria, Fairfax, and D.C. Dr. Levrini earned her PhD from Florida State University, one of only 10 combined PhD programs in the United States approved by the APA, or American Psychological Association. She has published numerous scientific articles on ADHD and has presented on ADHD-related topics in professional settings throughout the country. Dr. Levrini was a featured speaker at the 2009 International CHAD Convention in Cleveland, Ohio. She was also recently elected co-coordinator of the Northern Virginia DC chapter of CHAD and is authoring a book titled Tools for Managing Adult ADHD with the APA. It's my pleasure to introduce Dr. Levrini.
So my goal tonight really is to make this about practical real tools that you can take with you. One of the things we get in terms of feedback about some of our presentations is they're very general in terms of what are the symptoms of ADHD and so on and so forth. So my goal is, I'm kind of assuming that the general knowledge is there a little bit. Now, I'll touch on things about the disorder in general, but I really want to give you some real strategies that you can take home tonight, and that was my goal with the supplemental worksheets. Really, this could be a 2-day workshop, but we're just going to try to fly through as much as we can tonight in the time that we have. The other complaint that we often hear is that a lot of our things are geared towards children. So here tonight, we really wanted to make sure that we had some things for the adults, and it looks like we're going to need more, so that's good. The other thing, before I start, is anyone who's ever come to one of my presentations should know that I never come empty-handed. And tonight I have some lovely pipe cleaners that I'm going to pass around. And you may or may not know, as an individual with ADHD, one very important thing to do, take one, just take one, is we always recommend keeping your hands busy, getting some of that energy out, whether it's chewing gum. The pipe cleaners are there to bend and twist. It's a nice inexpensive thing you can keep at your office to play with. It's like a stress ball. Release some of that energy, and when you're doing that and you're releasing some of it through your hands, it's going to be able to keep your mind a little bit more focused and help you be able to pay attention tonight. If you don't play with it, take it home to your kids. And if you come tomorrow night, I will have green for St. Patrick's Day. So. Okay, brief overview about the book. As I mentioned, this is going to be published by the APA, hopefully this fall. My co-author is Frances Pravat. She's a psychologist and professor down at Florida State University. All of the tools and methods you see is pulled from professional research, including our own research in the field of ADHD, and our combined almost 40 years of experience in practice, putting these things into practice. As Dr. Johnson mentioned, I have my own practice, Psych Ed Coaches, in the area. There's our website if you're interested in more information. And Dr. Pravat also helped to launch the Adult Learning Evaluation Center down in Florida State, which is one of the biggest coaching practicum sites in the country. The idea is this is a user-friendly self-help manuscript. What we did is we actually created start and stop visual aids for you as you're reading to have about 5 to 15-minute segments so that it's not too overwhelming for you, because I know that a big part of a lot of these self-help books is it's just a lot of information thrown at you, and we wanted to make it very simple, straightforward, and short segments for you. And we have the following categories. We have quiz yourself at the beginning of each chapter, which I'm doing tonight. I'm going to have the quizzes on the slide, and I want you to take a look and just kind of answer the questions to yourself and think if that particular section sounds like you and whether or not it applies. What the experts say, I'm not going too much actually into this tonight because like I said, I want this to be about practical strategies you can take away, so I'm not going to be citing all the research for you. Can you relate to us? It's going to be case examples. Again, I might throw out a couple examples, but it's not a huge part tonight. What we are going to focus on is help yourself try it, getting back on track. These are the real nuts and bolts, things that you can do and take home with you. And then we obviously have chapter summaries, which are brief bulleted lists that are going to outline the important things in each chapter. So each chapter is a strategy, which is why we are calling tonight 10 strategies for simple living. The first strategy is to better understand your ADHD diagnosis. Now, as I said, I'm not going to go into great detail about this, but I am going to just point out a couple of things. Strategy 2, get organized. Strategy 3, improve time management. Strategy 4, set goals. Strategy 5, develop learning and study strategies. This is going to be a little bit geared towards college and graduate students, but also a lot of ideas that you can take with you to the workplace. Strategy 7, gain satisfaction with employment. 6, improve social relationships. 8, understand comorbid disorders and how to overcome them. 9 is about exploring non-medication-based treatment options. And 10 is about making the most of medication. So a couple things I want to say about better understanding your diagnosis. There's a lot of information. ADHD has become highly sensationalized. So reading through it and finding out what the facts are is just so important. And I think in order to really take charge of the disorder and to do any of the further steps that I have here outlined tonight, you need to do this step first. It's crucial. It helps you overcome insecurities, gain confidence, and also misperceptions about the disorder. So in the chapter, I outlined these in detail, but I'm just going to talk to you a little bit about what I believe the following these steps are in better understanding your diagnosis. And the first one is super duper important, and that is to get an accurate diagnosis. Now, there's essentially 3 people, but really 2, who can make a real diagnosis. That's a medical doctor, a psychiatrist who is just a specialized medical doctor, and then a psychologist. Now, each of these are going to do so a little bit differently, and I want you to make sure that whoever diagnosed you has an expertise in ADHD, because the problem is, if you go to a general practitioner who does not have an expertise in this field, they might ask you 3 or 4 questions. It's a really brief list, and then they decide you have ADHD, and you're running off with that diagnosis. That's not the best way to do it. There are so many disorders that can overlap ADHD, learning disabilities, bipolar disorder, for example, and your treatment is all based on what that diagnosis is. And if you get the wrong one, it's going to affect how things get put into motion, your medication, your treatment process, so on and so forth. So the best way to get diagnosed is to get a full psychoeducational, neuropsychological evaluation that not only says if you do have ADHD, but it eliminates all the other possibilities and says it is not this, not that. Okay, so just make sure that you have an accurate diagnosis, because that's going to formulate everything else. How to define your ADHD diagnosis? That's the symptoms. Just briefly going to say that there are 3 subtypes. It gets confused a lot about, do I have ADD, do I have ADHD? Just briefly going to point out, as of today, it is called ADHD, all of it. We have 3 subtypes. We have the inattentive, we have hyperactive, and we have a combined. So most adults are the inattentive subtype. Usually what we see is that hyperactivity drop off into adulthood, so even if you did have that component, it's oftentimes not apparent as an adult. Now, the ADD, what people think of as ADD, would be the inattentive subtype. It's gone back and forth, and it might get switched again. Actually, the diagnostic manual is being updated in a couple years, so this might again switch. But it's important for you to know. Another thing that's important for you to know is in the new diagnostic manual, they might actually for the first time have separate criteria for adults and children, which would be fantastic. But that has not yet been decided. So if you don't understand this stuff, like I said, I'm not going to go into greater detail than that, but make sure that's something you look into. Know what type you are. Identifying your scenario. In the book, what I do is I outline some different ways that ADHD manifests throughout the lifespan. Because if you were diagnosed as a child and learned to deal with this diagnosis growing up, it's going to be very, very different than if you were just diagnosed as an adult in your 30s, 40s, and so on and so forth. Because you didn't understand, and it might have affected self-esteem more and things like that. Or you might have just assumed you weren't intelligent, things like that. So what I do is I outline different subtypes, what I call scenarios, of people with ADHD. And that's also important to know because you have to understand yourself when you're going through treatment. 4 and 5, I'm not going to say anything more except for what it says. ADHD has nothing to do with willpower. It has nothing to do with intelligence. So don't think that you can just, want to get better and it's going to work. And the most frustrating part is, I think, getting other people to see this. We refer to ADHD as an invisible disorder. Because if you think about it, someone with a physical disability, it's very obvious, they walk up the stairs or in a wheelchair and are unable to walk up the stairs, you automatically have this empathy for them. You can see the disability, but with ADHD, it's not apparent. And so a lot of people do get frustrated and they think, well, they just tried hard enough, they could do it. I hear that so many times. Or, I don't understand, they're so smart. They can get good grades. They're smart, why? How can they have ADHD? That just doesn't make sense. But they're completely different components of the brain. And then finally, the hard proof of ADHD. Just kind of understanding it's a psychological disorder. We have evidence that it's genetic. It is one of the most rigorously studied disorders that we have. So its evidence is undeniable. Okay, so that's better understanding your diagnosis. On to strategy 2. Getting organized. And here's our quiz. I'm just going to read a couple of these. Are you constantly losing or misplacing everyday items such as your keys, cell phone, iPod, or wallet? Do you forget what color your desktop or kitchen table are because they are constantly covered in clutter? Is your briefcase or backpack full of crumpled bits of paper, candy wrappers, and possibly those lost keys? Do you insist something was never given to you only to find it weeks or months later? Okay, so these are the questions I want you to just think about. And I hear some giggles, so I think they probably are close to home for some of you. If so, this chapter is for you. I've outlined 3 steps to organization. Yeah, there. Yeah. And that reminds me, that was fine, but it does remind me that, and you all have done so far, but let's save the questions for the end so we can get through this. Okay, so 3 steps to organization. I'm going to go through the first strategy on the supplemental worksheet here in a second. There's before, this is your preparation. There's during, this is making decisions about how you're going to organize. And then after, which is maintenance and is often, I hear from my clients, the hardest part. Keep in mind, it's progress, not perfection. Also, your goal should just be to create and maintain a system that you can manage with relative ease to simplify your space. You're not trying to become the most organized person in the world here. This just needs to be something that you can use your strengths to come up with a solution that can fit into your life with ease. The more planning and preparation you do, the less time and stress the task will take. I know a lot of my clients also, because of that impulsivity factor, they kind of want to, they want this done 3 weeks ago. So they don't want to take the time to do the planning and preparation and dive right in. But I can assure you that the more preparation you do, it's actually going to save you time down the road. So let's take a look here at the worksheet, and I'll do my best to explain it to you for those of you who don't have it. This is the first exercise. It's getting organized. And the first thing I want you to do is, and we're not going to have time to complete this right now, but you can take it. The first thing I want you to do is think of an area in your home or office that you'd like to organize, and you're going to write it down. Then you're going to write down your fears about organization. Okay, so a fear is a self-doubting question, something that's keeping you from organizing your space right now. So those are things like, what if I can't follow through and complete my organizational needs? Or what will people think of me if they know how disorganized I really am? Or how will I ever keep things organized once everything is cleaned up? So what you want to do then is you're going to challenge them, and you're going to write a challenge thought for each one, a corresponding challenge thought. So these are your optimistic and realistic kind of glass half full ideas that serve to beat up on those doubts. And those are going to be things like, if I create and follow a step-by-step plan and I take my time, I will complete my organizational needs step eventually. Or no matter how disorganized and cluttered my house is, there are worse houses out there. And if you don't believe me on that one, just turn on the TV to A&E and watch an episode of Hoarders. All right? Another challenge that might be, by instilling new rules and routines, I will be able to stay organized with relative ease. So once you do that, I have a little fill in the blank here for it's progress, not perfection. I want you to write that down, so that act is going to get your head set there. Then what you're going to do is you're going to decide what is motivating you to organize that particular space. That might be getting your husband or your wife off your back. It might be having a nice organized space for your grandchildren or children to come over and be in. So what really makes you want to have that space organized? And you're going to write that down. Then what you're going to do, and this is at the point where it may be helpful to work with someone like a coach or a friend and get some support on ideas if you can't figure this part out on your own. You're going to decide how to break down your space into smaller segments in order to keep from being overwhelmed. So, and then you're going to list those from the easiest to the hardest. I'm going to talk a little bit more about segments in a second. Then you're going to look at those segments and you're going to create a specific plan. Okay, so I wrote down here, if it's a closet, perhaps you're going to separate types of clothing, blouses, pants, skirts, etc. For a desk, perhaps you need an inbox and an outbox and a place to store office supplies. So you're going to describe your vision. What does your vision look like for that space? Then in addition to writing it, what you're going to do is you're going to draw a picture. I find that a lot of my clients are actually quite visual. And so in addition to writing, sometimes drawing a picture of what your space looks like to you is helpful. Now you're going to decide on the rules. And I'm going to go into that in a second. What rules you can apply. So this is just a brief checklist I'm not going to read right now before getting organized. You need to do all this stuff in terms of preparation in order to be able to move to the next step. So take that checklist with you. When you want to organize your space, go ahead and go through the checklist. Yeah, the other one. More than that? Yeah, no worksheets. Okay. This is the PowerPoint. Okay. All right. Now here are your rule ideas. Okay. I'm just going to go through these real briefly, and you can kind of see which ones speak to you. Keep, throw, or donate. What this is if you're going through a closet or a space like that, you're going to decide on these 3 categories. Do you want to keep it, do you want to throw it away, or can you donate it? And you can either set up some plastic bins and label them. You can lay blankets on the floor if it's a lot of stuff, and you can have 3 separate blankets, and or even a paper grocery bag if it's papers and things like that. That's the first rule. Divide and conquer. This is what I was talking about in terms of segments. A space can always be broken down into smaller spaces. Okay, so I know it's easy to take a look at a closet and say, I have to organize this whole closet. This is really tough. I don't even want to touch this. Start to try to space those into small areas. Well, you have an upper shelf over here. You have hanging clothes here. You have a dresser maybe. You have your shoes down here. So it's not a closet. It's actually 6 different areas. So you're just going to choose to tackle one of those at a time. Now the same can be done in terms of using, for example, grid lines in a room. I actually had one client take string and in a large room actually just went through and created segments in his room. And he had a north, a south, east, west wing. And he went through and he just treated those all as separate smaller rooms. So divide and conquer. Space can always be divided into smaller spaces. Time can always be broken down into shorter segments of time. Photographs. This was a really great idea. One of my clients brought to me actually. And her idea was to take before and after photographs. Now, this helped in a variety of ways. One, it showed her what an organized space looked like. So she organized her space, she had her after photograph, she posted it there, and then when it started to become a little bit messy again, she knew what it was supposed to look like and where everything was supposed to go. Another thing it did was it served as motivation because she saw that she could do it. She did it once before, she could do it again. So when it started to become unorganized, she could do it again. So it's really good in those 2 ways. So use photographs whenever you can. Pick a spot. This is for your routine, everyday items. So your keys, your cell phone, all those items that are constantly going in and out of the house need to have a home, as we call it. You need to have a spot that they go to every day. A charging station, preferably by the door for keys and things like that. The closer you can get it to the door, the more likely it is going to stay there. So pick a spot for those routine items. And insight in mind. Now, unfortunately, our houses aren't made of plexiglass, but that would be nice. But what we can do is as many plastic clear containers as you can use. Open filing systems rather than in drawers. As visible as you can make things, that's going to make them easier to find and easier to remember. So those are your rules that you're going to plug in here that you feel like might work for you, and then you're going to write down how you can apply that particular rule to your space. And these are just some ideas I'm not going to read here either, but some maintenance after organization rules that you can apply in order to keep your space